Masturbation is harmful, ejaculation is harmful, but partnered sexual vaginal intercourse is healthy. Your body doesn't care, like one way or another. It doesn't know if it's ejaculated into a vagina or onto an iPad.
Masturbation is something that we do in utero.
Yeah.
Welcome back to the Rena Malik MD podcast, your source for accurate, evidence-based information about your sexual health and more. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we had the pleasure of having a guest, Dr. Eric Sprankle. He is a professor of psychology at Minnesota State University and an expert in masturbation, everyone's favorite topic. He recently released a book called DIY Masturbation, The Wonderfully Weird History and Science of Masturbation. And we talked about masturbation. And we covered so many myths, all those things you've been wondering about, like, is it safe to masturbate? How often should you masturbate? Am I going to injure myself? Am I going to harm myself? What is the problem with masturbation? We cover all of it. We also cover semen retention and No Nut November. Why do people participate in this? And is there truly any benefit or potential harm to participating? And lastly, we cover some of Dr. Sprankle's interesting research on satanic sexuality and how sexually degrading music videos may impact the viewers. And lastly, we also talk about sex workers. Why, in fact, are sex workers discriminated against? And what are some misconceptions that we have about sex workers? I think there is so much interesting knowledge in this episode. I hope you guys enjoy all of it. Welcome, Dr. Sprankle. It's an honor to have you.
Thanks for having me.
So you wrote a wonderful book
Thanks.
about masturbation. So let's tell people why they should masturbate.
Because it feels good. I mean, that's the number one reason. We oftentimes try to, put masturbation a little bit up on this pedestal. And by we, I'm saying like sexual health educators and things like that, of like, it's good for relaxation and stress reduction, and can help you sleep and can ease pain and has all these like health benefits, or at least associated with health benefits. And there are physiological reasons as to why that could be based on what happens during orgasm, during masturbation, or with partnered sex. It doesn't really matter. But what gets overlooked, I think, a lot, and kind of how I end the book, is making sure that we're just focusing on the number one reason why people do masturbate, and that's simply just pleasure. It's a moment just to yourself to feel good, and that's all the justification it needs.
Yeah, I think that's absolutely true. I always say that really the benefits come from orgasm. And we, for some people, the only way they're going to orgasm is through masturbation. And even if they have other means to achieve orgasm, that doesn't mean that they have to stop masturbating.
Yeah, absolutely.
There's a lot of negative rhetoric about masturbation that's been around for many, many years, but that wasn't always the case in history. Can you share a little bit about the history of when masturbation was sort of accepted?
It depends on the particular culture, but for most of human history, people didn't really care about it. It certainly wasn't viewed as this destroyer of bodies and souls and civilizations. Like at most, it was kind of like the butt of jokes sometimes, of like, oh, you can't get a partner, so you're left with, and you have to resort to masturbation. But that was about it. Religion, particularly like Judaism, and then the follow-ups of Christianity and Islam, really started kind of focusing in on a lot of different types of sexual sin. Masturbation just being one of pretty much everything imaginable sexually that you can do that's not permissible within those particular religions. And that's when it started really kind of taking on a negative connotation of like, no, this is bad, this is sinful, you'll go to hell. And then that carried for a millennia or so until early 1700s, in which doctors started kind of incorporating their focus on disease and health promotion, but they were left with still like this religious belief about masturbation, that it's wrong and it's a sin. And so even as physicians during this time, the 18th century and 19th century, they were really focused on how masturbation is now harmful to your body. Of course, they didn't have any actual data to support that. It was just all driven by their religious beliefs. But that's kind of like a quick little trajectory of how it really wasn't a big deal for most of human history. And then it started becoming a sin. And then this is a health problem. And then the health problem piece is totally pseudoscientific then.
Yeah, I think that it's interesting how these myths in medicine perpetuate for years and years. And probably to this day, there are doctors who hold these beliefs. I'm pretty certain of it. But I think that there's no scientific knowledge behind any sort of negative connotation related to masturbation,
Right.
as far as we know.
Right.
And there's also no physiologic change in the brain due to masturbation. And there's no physiologic issue with the act of ejaculation.
Right. Yeah. And, those types of claims that masturbation is harmful to your body, ejaculation in particular is harmful to your body. You don't have to be a scientist to start like poking holes in some of those arguments, because typically most, not all, but most will say that masturbation is harmful, ejaculation is harmful, but partnered sexual vaginal intercourse is healthy. And it's like, your body doesn't care, like one way or another. It doesn't know if it's ejaculated into a vagina or onto an iPad. An orgasm is an orgasm for the most part, but they kind of hone in on the act of an orgasm alone. Somehow your body knows that this is bad, so I'm going to ejaculate things that you need, like the vital nutrients and stuff like that. And so, yeah, it's just largely just like made up, but it sounds very scientific. A lot of times they do like cite some articles to supposedly support their claims, but the articles that they're citing are definitely misunderstood. It's not that necessarily, sometimes the articles are the research is kind of shoddy and it's kind of bad. A lot of like the porn research historically hasn't been the greatest, but oftentimes like with masturbation is bad because it lowers testosterone or it like causes depression or ED. Like, yeah, you can find citations that kind of support that, or at least you think it supports that, but it's really kind of a misrepresentation of the data.
Yeah, or it's very small numbers and not clinically significant findings.
Right.
So absolutely. And in fact, you mentioned this in your book, but masturbation is something that we do in utero.
Mm-hmm. Yeah, that was something I heard, I don't know, back in college. Maybe it was briefly mentioned in my human sexuality class that I took as an undergrad. And that always stuck with me. I always remembered that. And so when I started writing the book, and chapter 1 is focused on, childhood sexual development, I was like, I need to see if like that was a myth too. And so, but it's not. There's a lot of data, ultrasound data that has shown fetuses masturbating in utero. And people are very uncomfortable with that topic, understandably. It's not something that you normally talk about. But I think that is a reflection of adults projecting what masturbation means to them as an adult onto younger kids or even like fetuses. And when a fetus masturbates, it's doing so based on like stimulus response. It's a self-soothing mechanism. They found it through happenstance. And it's like thumb sucking or body rocking. It's just a self-soothing behavior. They lack the ability to like have sexual fantasies. They don't have anything to really promote sexual desire. It is really no different than just self-soothing.
Yeah, absolutely. And why do fetuses and then little babies stop doing it?
Typically because they're scolded by parents. A lot of parents will freak out. Historically, what shows up in the medical literature on this is when parents think that, especially their infant, if their infant is masturbating, they do so in a very kind of clumsy, overly dramatic way, because they don't really have the greatest manual dexterity to masturbate as like older kids, teens, and adults do. So they're kind of like engaging like body rhythmic kind of behaviors, hopping up and down, lots of, they're not verbal yet. So it's just a lot of like grunting and kind of weird vocalizations. And the parents are like really concerned. They think that the child is in pain. A lot of times it's misdiagnosed as some type of seizure disorder. And so these kids go through like a whole host of tests to kind of rule out these worst case scenarios. And then the physician just has to inform their parents ultimately when all the tests come back negative or unremarkable, be like, your child's just a masturbator. And that may be bad news depending on the values of the parent. And that's why there are some interesting euphemisms that physicians use for when really young children, like infants or toddlers, masturbate. They'll call it things like infantile gratification phenomenon. It's a little easier for parents to hear. It's like very clinical compared to like, yeah, your infant's a self-diddler.
Yeah, I had never heard of that one. But that makes a lot of sense.
Yeah.
You mentioned that there's this life force, right? I think there's a lot of people, and I think it's important to mention that a lot of people make a lot of money coaching people on how to not spill semen or not ejaculate or practice semen retention. And I think people don't realize that. They think like, oh, these people are trying to protect me, make me better, make me fix my problems in my life. But in reality, they're running a business and they're making a lot of money from it. But where do you think this idea of semen being this life force and spilling semen anywhere outside of a vagina, being a horrible thing, where does this come from?
Couple different origins within religions, Hinduism, Taoism, even within Judaism. Judaism's more so of just like not spilling seed, not really thinking there's a vital like life force in there other than just the importance of saving sperm for the purpose of procreation. But definitely within Taoism, that has viewed semen as kind of like an essential life force that has power. And if you deplete it, you're kind of depleting your overall life force that can be fatal or shorten your longevity. So that's what I see a lot, that these individuals online who really spout some anti-masturbation nonsense have really appropriated a lot of like Taoist beliefs about masturbation. And what's interesting is that they don't adopt any other Taoist philosophies or practices or beliefs. They just this one piece of like, which is just like anti-masturbation, anti-ejaculation that really kind of like grab them, be like, oh yeah, see, it's like thousands of years old, so it can't be wrong. So kind of engaging in that kind of logical fallacy. But it certainly has its roots in that. And I think Taoist writers will talk about the importance of ejaculation and just ridiculous claims that can be easily falsified, saying that a tablespoon of semen contains the nutritional equivalent of like 2 New York strip eggs or two New York strip steaks, like a dozen eggs, a lemon, an orange, and all these things combined. It's like, where are you coming? You know, that can be tested, right? We can do a semen analysis to see what's in it. And that's the thing too, of kind of having like half truths, because there are some nutrients in semen, but those nutrients exist either primarily just to help the sperm, either for the life of the sperm or to make their journey a little bit more hospitable. It has nothing to do with like providing nutrients to the host of the ejaculator.
I've heard a lot of myths. I know you've probably heard a lot of myths about masturbation. And you talk about it a lot on your social media and you get a lot of pushback. So what are some of the most shocking myths that you've seen?
Well, what started this all off was, they're not overly shocking. It was just kind of more concerning. And, my background within clinical psychology, because they were talking about, oh, when you masturbate, you get depressed, you get socially anxious. So you had like these psychological effects. And I was like, okay, maybe I missed that day in grad school when we covered that, but it doesn't sound right. And so that was the most interesting to me, of like people thinking that they are becoming like developing like mental disorders as a result of their masturbation habits. And so that was interesting to kind of explore like what's actually going on. And for those kinds of guys, I don't doubt that they experience that, like they physically feel like unwell after masturbating, but that's driven by masturbation guilt and a misinterpretation of bodily sensations after orgasm. Most people think orgasm feels great, and then afterwards they feel like relaxed and content and satiated. But for these nervous masturbators who feel a lot of guilt about what they just did, they interpret those post-orgasmic sensations as amotivation and fatigue. And so they pathologize it themselves. And so they think like, see, this is very unhealthy for me. But historically, one of my favorite guys to read about was, he was a reverend in Connecticut in the early 1800s, Sylvester Graham. And he wrote a book, a lecture on chastity to young men. And I think like 1837 or something like that. Fascinating read, because essentially it's just organized based on bodily systems. So there's a section on like the digestive system and the nervous system and so on and so forth. And in it, it's just pretty much every disease and every symptom imaginable that can affect that bodily system. And he blames masturbation as either being a cause or a consequence for all of those. And it's ridiculous. Like, it's not just like the hairy palms and blindness. It's things like cerebral hemorrhage, tooth loss, violent belching, discharges from the anus, unclear what kind of discharge, but just ridiculous things. Is like, And this guy was just, a pastor. He's a reverend, and he said he like brushed up with some medical textbooks, but like this is all just like made up. Like,
Yeah.
and he has to know that as he's like writing it. Of like, yeah, there's no evidence to say like you masturbate and all of a sudden you have this violent belching, episode. So there were grifters back then, and then there's grifters now on social media, kind of spouting the same nonsense.
Yeah, it's interesting. I think that if you ask these people, they will, they're very good orators.
Mhm.
So they will very convincingly explain their logic. And
Right.
I think to their core, they probably believe it
Mhm.
because that guilt is so strong.
Yeah.
And that they really want to share that they feel like they've transformed their life because they abstained.
Mhm.
And I tell people, if you feel like there's some benefit to you, like if you are really having mental illness, like you're feeling depressed and anxious every time you masturbate, then maybe there's a value in abstaining for some time.
Mhm.
But probably more valuable is actually seeing someone and
Mhm.
talking about it, you know?
Right. Yeah.
But if it makes you feel better and it's a sustainable solution and you're not like grinning and bearing it all the time, then I think it's okay, you know?
Yeah. And that's the irony, right? It's a self-fulfilling prophecy. So in terms of like psychological effects, negative effects from masturbating, there aren't any unless you think there are some, right?
Mhm.
And that's the irony, that if you think masturbation is unhealthy, it's a sin, it's immoral, I shouldn't be doing it, it's bad for my body, it's bad for my relationships, and then you do it, yeah, of course you're going to feel bad afterwards. You're going to feel guilty. You're going to feel ashamed. And that can be bringing up symptoms that look a lot like depressive symptoms and anxiety symptoms. And yeah, so for those individuals, it's like, yeah, you probably shouldn't be masturbating because, you feel terrible afterwards. But just know it's not the masturbation per se, because a lot of people can do this, no problem whatsoever. It's your relationship to masturbation. It's your attitudes and values toward masturbation. That's actually the problem.
Yeah, and there is a medical phenomenon called post-orgasmic illness syndrome. Now, it's
Mhm.
exceedingly rare,
Yeah.
but it's
Mhm.
with any orgasm,
Right.
not just masturbation, where people feel physically ill
Mhm.
after orgasming. And if that's you, absolutely see a doctor, but it's rare. It's exceedingly rare, and there are a few people who have it, but I think there's probably more than we know of, because in the literature, there's not that many, but if you go on Reddit threads or things like that, you'll see a lot of people actually talking about it.
Mhm.
And I think that's a separate phenomenon from feeling guilt and shame and
Mhm.
depression and anxiety just with masturbation.
Right. Yeah. And that's an interesting thing too, because I think, that there is legitimacy in some people's experiences. And, I think everybody's experience, regardless of like what the origin is, whether it's guilt and shame, or it is kind of like this interesting phenomenon of the post-orgasmic kind of illness. But what you see online with like the spouting of the nonsense, the pseudoscience, that's certainly, I don't, in my opinion, it's not coming from the post-orgasmic like illness folks. It's coming
Right.
more from the masturbation shame groups.
Yeah, absolutely. So everybody wants a number. How much is too much?
Yeah. And that can range from 1 to 100. That's the thing. Like from a clinical perspective, assessing somebody, if they came in seeing me for treatment, like my masturbation is out of control, I'm watching porn way too much. My first question is not like, well, how much are you doing it? Because that number doesn't give me much information at all in terms of determining whether or not something's a problem. Because if somebody thinks that they should never masturbate, and that's like the worst thing for them to do, masturbating just once a year is going to be a problem for them. And they're going to feel as if they are out of control because they're doing something that they're telling themselves they shouldn't be doing, as opposed to somebody who doesn't have those kind of restrictions placed upon them in their life. And they're like, yeah, I masturbate when I feel like it, whether it's through sexual desire or just because of tension release, whatever. And sometimes it's a couple of times a week, sometimes it's a couple of times a day, and they feel perfectly fine about it. It doesn't interfere with their life. So just like with anything else, assessing for psychopathology, we're looking at, is there distress? And again, like I was just saying, distress isn't really tied to a particular number, like a threshold number. It's really just like, is it too much for you? What you think is too much? Again, can be 1 to 100. The other thing is, which is more rare, is like, how is it impacting your life? Like, how is it negatively or interfering with your life in some way? That can still be related to just guilt and shame, because, and I see this a lot, or when I was doing clinical work, I saw this a lot with couples that, again, it was, if you ask them how often they were masturbating, it was like daily. And it's like, okay, a daily frequency. A lot of people engage in that, no problem whatsoever. The problem was that they got caught by their partner, oftentimes a spouse, that they were masturbating when there was like some oftentimes unspoken rule that we shouldn't be masturbating because now we're married. And masturbation is akin to cheating in that relationship of how it's viewed. And so, yeah, it's having a negative impact on their relationship. But is it masturbation per se that's the problem? No, because someone can masturbate with the same frequency, same type of like relationship. And if the other partner's cool, if they recognize that, yeah, people in relationships still masturbate, then it's not a relationship conflict. It's very contextual. It relies on the individual's values. And if they're in a relationship, it relies on their partner's values too. And that really determines pathology more than any kind of magic number of how much is too much.
So how do you work through that with a couple? If there's one partner who says, I think masturbation is something you shouldn't do in a relationship, whereas the other one has been masturbating and wants to continue.
Yeah, you kind of view that as a desire discrepancy. You can do some kind of normalization of what masturbation is within a relationship, that it doesn't have to be threatening. It doesn't have to raise a lot of insecurities. That doesn't eliminate the insecurities that it does bring up for them. So it's important to kind of walk that fine line between kind of normalizing something, but not invalidating their experiences of being insecure or uncomfortable with their partner masturbating. But I think a lot of just kind of basic education about masturbation in relationships can be helpful, of that just because we're coupling doesn't mean we're losing our solo sexuality, our sexuality as an individual. We're bringing that into a relationship. And as that relationship ends, we continue to have that own sexuality for ourselves. And that can look just like, have sexual thoughts, finding other people attractive that you're coming into contact with on a daily basis. These are all very normal things. We don't shut down our sexuality just because we're coupled and it all gets focused in on that one partner. That doesn't mean that we have to have like open relationships and anything like that. You can be monogamous with a partner. But a lot of times people take that definition of monogamy to include no masturbation. And ultimately it comes down to like, is there any kind of wiggle room? Is there any kind of compromise there? If they're masturbating, can it be with like, sexting photos from the spouse or something like that? There's concerns about them watching pornography and finding other people arousing. Whatever the case may be, you kind of look for some middle ground there. But ultimately it may come down to like, this is quite a wedge in the relationship. And how I always approached couples therapy when I was doing clinical work was, and I would be very transparent with the couple up front of like, my goal here is to make you individually as healthy as possible and you as individually healthy as possible. And hopefully as you both become healthier, the relationship also becomes healthier. But what can also happen too is that as you both become healthier, you realize this relationship may not be the healthiest for either of you. And that may be an ending of the relationship. So just because the relationship is ending through the progression of therapy, that doesn't mean therapy is failing. It could actually mean that therapy is succeeding because it's pointing out this issue that is not going to have an easy chance of reconciling.
Yeah. So you think, is that something people should talk about before they get married? Like, or before they get into a serious relationship? Like, what do you think about masturbation?
Absolutely. Because if not, you're going to get caught. There's going to be evidence that, whether it's, sex toys in the house.
Get caught in quotes because
Right.
It's not a bad thing.
Right. Yeah, exactly. Yeah. But it's in the moment, it feels like for these individuals, like, they're a teenager again, getting caught by a parent doing something bad. And I think that's, a big, reflection of how we view masturbation, that it is like this secret, this dirty secret. Right. And that's when I talk with couples, the difference between like secrecy and privacy. It's like privacy is that you're transparent with something that you're doing, but you don't have to announce it every time that you're doing something, right? You can have some privacy around it, but it's not a secret that it exists in the relationship. Problems arise with secrets, not with privacy. So the secrecy is like feeling ashamed and guilty and deleting browser history, stuff like that, and then ultimately kind of getting caught. And then that can feel like a betrayal for the other partner. And the therapeutic issue at that point is more dealing with the violation of trust than actually what the other person was doing sexually alone. But yeah, I would definitely advocate for these conversations to be had early on in a relationship, making sure that you're on the same page and that you're comfortable so you don't have to live in secrecy, that you can just have a private solo sexual life.
Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalicmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you. Is there an optimal way to masturbate?
I wouldn't think so. I think it differs for everybody. People, that's the great thing about masturbation. It's your first sexual experience for most people, and it's your first sexual partner, so to speak. And you figure it out through trial and error, right? You kind of stimulate yourself in different ways. You know, it's reinforcing on its own. So you're going to be kind of guided and shaped to kind of stimulate yourself in a way that works best for you. And that's awesome. You're going to figure out the way that your body best responds to sexual touch. The only time where that can become not so great is if now you're in a relationship, your body is responding to a very specific type of stimulation that can't be at least easily replicated with a partner. And then you may be experiencing arousal difficulties with partnered sex, orgasmic difficulties, things like that. And then oftentimes, unfortunately, in these scenarios, masturbation gets blamed. It's like, see, masturbation causes sexual dysfunction and it's ruining partnered sex for me. It's like, no, I see where you kind of drew that conclusion from, but let's back up a second. You figured out how your body best responds to sexual stimulation. You just need to teach your partner how that can be done to you. I mean, if it's not a practical way for a partner to stimulate your own body, then like you need to bridge that gap. Then what can be done with a partner versus what you're doing alone by yourself with masturbation, and how can these two worlds kind of join a little bit better? It's not taking away. It's not saying don't masturbate anymore. Just focus on partnered sex if you want to have a healthy relationship. No, it's like merging these two worlds because again, you found out what works best for you. That should be celebrated. Now let's try to apply that with a partner.
Yeah. Do you ever encourage like varying the type of masturbation in those situations to more match what you're doing with a partner?
Sometimes in extreme cases. So I had a patient once who would masturbate lying like on their belly, like so face down, and they would kind of make a partial fist so their knuckles were raised and they would grind their penis on their knuckles like that. That's not going to feel anything like oral sex, vaginal sex. And so they were experiencing some, I think, if I remember correctly, erectile functioning was okay. It was just kind of a delayed orgasm for them. So they're having a hard time climaxing because it just wasn't feeling the same. In that instance, we talked about different ways to have a solo orgasm that kind of better replicates partnered sex. So we talked about like a more traditional kind of grip on the penis, using lube, possibly using like a masturbation sleeve or something like that to kind of condition your body to be able to have an orgasm from a whole host of different types of stimuli. What's important in those conversations and through that treatment is to not vilify the type of masturbation that they were having, because that was great. That was working well for them. That was their go-to, but just kind of allowing their body to respond to now a variety of different touch. And so it's just expanding their options.
Yeah, absolutely. I had a bunch of questions from my audience,
Yeah.
so maybe we can answer those. And I think some of these will be quick. Will masturbation bend your penis?
Good question. I've heard that. I would defer more to you because this would be more of a, I would refer to a urologist for this kind. If, a patient came to me as a therapist with this kind of question, I have heard from like a tight grip, kind of repetitive use that there can be a little bit of a build, not necessarily Peyronie's per se, but a little bit of a bending to it. But have you seen that where it's actually more like
I wouldn't say
clinically remarkable?
I wouldn't say from we don't think it's so Peyronie's, which is curvature of the penis. We think it is from micro trauma potentially. But if you think about it, like the penis withstands quite a bit of trauma, right? It's meant to be used in an aggressive fashion for intercourse, right? And so I think it's also genetic components and things like that. And I think similarly, probably if you're getting micro traumas from aggressive masturbation, it's probably there's something else going on that we just haven't figured out yet.
Right. And the important thing is too, like penises bend, they're curved, they're not always just like straight. And so like, is the concern more aesthetic? Is it more of like a body image disturbance of like any kind of bend that they're concerned about? And they think, oh, what caused this? And they're blaming masturbation. So now they want to back off. And so a lot of like kind of body image stuff may have to go into that approach of like, a lot of penises curve, and that's not going to be a problem for you.
Yeah, a lot of penises are naturally curved. I've talked about that before on my channel, and I think it's important to realize like most penises are curved, actually. So within 15 degrees is very, very common.
Sure.
Does it reduce sperm count?
No, unless, you're trying to get pregnant and you're masturbating like 5 times a day. And then on that 6th time is going to be the intercourse. And it's like, okay, you're not, operating at like full capacity. The research on this in terms of like how long you should abstain if you're trying to, procure a semen sample that has the highest concentration of like sperm, at least quantity of sperm. That varies, and usually it's just a few days, but then they have to offset that with the best quality of sperm. And so not just, abstaining from a month, you may not have the best quality of sperm in there. And so generally what I've read is that there aren't great recommendations of like the frequency of masturbation or ejaculations in general in order to like optimize your sperm count.
It's still a little murky, but I think daily to every other day is reasonable. When you get over 5 days that you start seeing those changes that are more negative in terms of DNA fragmentation in the sperm itself.
In terms of abstaining for 4 to 5 days.
Is edging for a few days unhealthy? And let's just define edging as well.
Sure. Edging is taking self-stimulation in the realm of masturbation. It's self-stimulation to the point of orgasm, but kind of backing off before actually having an orgasm. So if on a scale of 1 to 10, if 10 is the actual peak where you're noticing the orgasmic climax and contractions, you're taking yourself up to a 9, 9.5, and kind of riding that wave a little bit before taking yourself over. And this takes some skill to kind of be able to do that, to kind of know where your limit is and what you need to do to kind of back off a little bit, but maintain arousal. But so how long were they edging for?
Days.
Days. Okay. I've only seen that really that has been substance induced. People have gone on like methamphetamine binges and have not necessarily edged for that long, but have had almost like continuous like sexual behavior for a couple of days. I'm assuming there are breaks in there. I'm assuming you're eating. I'm assuming you're sleeping. So as long as you're taking some care of yourself, that it's not like 72 hours of like not eating or sleeping and you're just like masturbating straight, that may be some problems for not like sleeping or eating. But yeah, for the most part, edging is fine. Again, your body doesn't really care, like having an orgasm, not having an orgasm, riding that line. It's like, whatever, do what feels good. Like, do you need to be someplace? Like, you can't edge like on public transport, like not at work. So like, is it going to be interfering with your life in that way? So just these common sense kind of stuff. But for the most part, edge away.
Yeah. And then can you use masturbation to help you last longer?
Last longer in terms of like delaying ejaculation. Sure. Yeah. And that's actually the basis of behavioral intervention for premature ejaculation, known as the stop-start technique. Stop-start technique is essentially learning how to edge. It's taking you up because for guys who are very rapid ejaculators, sometimes, within just a matter of seconds, 5 seconds, 10 seconds, things like that, they're essentially going back to that kind of 10-point scale. And I used to do this. So I would draw it out in my office for guys who had premature ejaculation. I was like, okay, 10-point scale, that's arousal on that axis, and then the x-axis is time. Graph for me what your orgasmic response looks like, right? And so for guys with premature ejaculation, it's just quick up and down, right? Very fast, and that's it. And so the goal then is to elongate that. And then the goal is like, well, how do you know that you're at a 5 instead of a 10? And so for guys with very, very rapid ejaculation, they don't. It's just kind of like a whirlwind and be like, okay, that happened, right? So it's getting them to slow down a bit. And that may mean through masturbation training that you're not using any lubricant, you're not watching any pornography, you're trying to keep it as analog and as bland as like possible to try to like slow things down, slow your rate of masturbation, ease your grip, right? You're still self-stimulating, but you are gaining control by just making some of these minor changes. And then over time, you start having that, once they start getting a little bit better control, then you start incorporating elements that would be a little bit more similar to partnered sex. And so now you're adding lubricant. Maybe you're adding like a visual stimuli in there, like pornography, adding a sex toy like a masturbation sleeve, and then continuing these exercises of like slowing down, even stopping when you need to, and continuing. That's essentially just edging. It's masturbation training, but yeah, that can help prolong. I will caveat all that with like, how long do you actually want to go, right? It's the myth of like going all night violates the laws of friction. No one actually wants to do that. So it's like, I've had patients come in saying that I'm a premature ejaculator. I want to last longer. We talk a little bit about what's their ejaculatory latency, like, the timing it takes them to reach orgasm. There's like, usually around like 15, 20 minutes or so of like intercourse, and then I ejaculate. I'm like, okay, like how long do you want to last? Like at least 45 minutes. It's like, okay, we may be talking like delayed ejaculation at that point of like constant intercourse for 45 minutes. Like, okay, you may be delayed at that point. So a lot of times you just have to adjust expectations of like what's a normal, typical, like 2 to 7 minute kind of ejaculatory response. And that's okay. And if you have an orgasm sooner than you would like, that doesn't have to mark the end of sex. Like what can you pivot to still be engaged with your partner and still engage in like different types of sexual behavior that may not be dependent on an erection or another orgasm.
Can you get addicted to masturbation?
People can think that they are addicted to masturbation. Absolutely. People come into treatment all the time saying, I'm a porn addict, I'm a masturbation addict, I'm a sex addict. And for them, it's real. And so this debate, it's a very heated debate, has been going on for decades now in our field of like, is that a real thing? And we kind of do a disservice by just saying, no, it's not a real thing, because it kind of minimizes and dismisses and validates a lot of people's real like experience and pain and like ending relationships because of this, right? So how I usually start this conversation is like, yes, people can think that they're addicted. People can masturbate in a way that's unhealthy for them. That's a problem for them personally or relationally. So absolutely. But like what we talked about earlier, there's no magic number of what is considered like too much. So then it goes back to it's too much for them. And that may just be masturbating once. And so if you're telling yourself that I shouldn't be masturbating at all, it's a sin, it's considered cheating because I'm in a relationship, but you had a moment of weakness one night and you masturbated and you wrecked with guilt afterwards and you feel out of control and you feel addicted. Research has shown like that is more likely to predict the self-diagnosis of sex addiction, porn addiction, masturbation addiction, that this what's called moral incongruence, that your values aren't lining up with your behavior. Your values are saying, don't do this. Your behavior did it anyways. That's an incongruence. You're feeling out of control. You're feeling addicted. Those without that incongruence, they have no problem masturbation, no problem masturbating. They think it's fine. It's healthy. It's not interfering with their life. Their partner's cool with it. They're not going to have that incongruence, whether they're masturbating every day or just once a week. And so they're not going to feel out of control. They're not going to feel addicted to it. And so I don't like that word addiction because it doesn't operate similarly as like substance use disorders. But that's the kind of the language that we have to work with right now. And that's what clients and patients are coming into treatment for, labeling themselves as a masturbation addiction. But it just doesn't work that way. But
Yeah.
that doesn't mean that they don't need treatment. The treatment just looks a little bit different than like 12-step or abstinence-based treatment.
Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there. So what does the treatment look like for someone who has that incongruence?
Yeah, and so it's identifying that incongruence, knowing that it exists for them. So that's a little bit of education of like, what are your values? How do your values align with your behaviors? And oftentimes with more of like a sex negative approach to treatment with some of these issues, when you have this incongruence between values and behaviors, the focus is just on changing the behaviors. It's like, okay, you're masturbating or you're watching porn. That's bad because that's not living up to your values or your standards. So we need to get rid of masturbation, get rid of porn in your life, and then you'll be congruent. It's like, okay, well, that's one approach, but let's also look at your values. Where did these values come from? Are they very important for you? Or are they just kind of leftovers from what your parents gave you? So there's some wiggle room within those values too, or there could be wiggle room in those values in which you can kind of decrease the harshness of the anti-masturbation attitudes and values a little bit, where masturbating like once a week now is permissible, right? They still don't want to do it daily. They think for whatever reason that's going to be bad for them or interfere with their life or hurt their relationship or some way. But you gave them a little bit of wiggle room now that their values are permitting them to at least masturbate like once a week if the urge arises. So that's really it, of just kind of trying to find that where that nice balance is between values and behaviors, all the while being very accepting of like, you're a sexual person. You have sexual desire. This behavior isn't coming out of nowhere, right? It's being driven, so to speak. And so we kind of have to like honor and respect that, and trying to repress it and say, no, I don't want to do that. That's wrong. That's where it comes out kind of sideways. That's where it comes out in secret ways. And that's what's going to get the person in trouble, relationally, intrapsychically, things like that, sometimes like legally. And so it's acknowledging and accepting that you have sexual desires, you have sexual fantasies, and then sometimes those fantasies are atypical, and that in and of itself creates its own level of like guilt and shame. So you have to work with, you know, normalizing and validating even atypical kind of fetishes or fantasies, and realizing that, yeah, this is just who you are. And if there is truly a conflict between who they are and kind of like the value system that they've built around themselves, then they have to recognize like that's kind of their cross to bear, so to speak, right? It's like, you are this person, you're placing these rules in front of you. That's going to be hard work, right? And at that point, it also almost becomes more of a religious issue than a sexual issue. It's like, you're struggling adhering to your faith. I'm trying to help you recognize that you're a normal sexual person, but it's just coming in conflict with these pretty strict religious beliefs. So this is kind of more of a religious issue than a sexual issue.
Yeah, it's tough.
It is. Mm-hmm.
You know, you mentioned that as a fetus, we use masturbation to self-soothe,
Mm-hmm.
but sometimes it doesn't have to be sexual, right? It can be also just a soothing behavior.
Yeah. That's definitely true for fetuses and infants, but we carry that with us for the rest of our lives. Masturbating for pleasure is always what the research shows is the number one motivation, but in the laundry list of other motivations, yeah, self-soothing, it's relaxing, can help you sleep. Sometimes it can alleviate pain, at least the perception of pain. So it has all these different values, all these different motivations as to why we may engage in it. And it can just be simply as like, yeah, it's just kind of relaxing. And you may not have like sexual desire or feel like horny, so to speak, and like, oh yeah, I just need to masturbate to kind of have an orgasm. It's like, no, masturbation feels good, it's pleasurable, got a few minutes, why not?
What about masturbation to pornography? I think people have, as you mentioned, the porn research is sort of all over the place in terms of quality. I think a lot of people lump pornography as this evil thing.
Sure.
And and that masturbation to pornography is somewhat inferior or horrible for people to participate in. What can you tell people about that?
Yeah, so very, very complex issue. A lot of times when we talk about porn effects, we're just talking about like masturbation effects, right? Because even the language we use around it, like when do you use pornography? Like we don't say, do you use Netflix? It's like, so what are you using pornography for? To masturbate, right? So a lot of times we kind of deflect our anxieties and our concerns and our insecurities about masturbation onto porn when the actually underlying issue is, guilt and shame still about just masturbation with or without pornography. But with porn is what's interesting is that you can have a lot of ideological opposition. So it's important when we have these conversations, when I speak to it from like more of a scientific perspective, it's like, I'm not arguing it based on like religious values of thinking like watching pornography is a sin, right? That's an ideological argument. I'm not arguing it in the sense of it is furthering the objectification of women. That's an ideological argument. We can talk about, does the watching pornography impact like misogynistic attitudes or behaviors? That would be scientific. But just the fact that pornography exists is misogyny. That's an ideological argument. So I want to focus then on the scientific piece of like, is porn destroying your brain? Is it destroying your penises? Is it destroying, killing love, like some of these claims are making? And the answers to that, like maybe, sometimes, it depends. No, it really depends on the user, and kind of goes back to what we were talking about of like, does masturbation addiction exist? It's like, for some, it can. Same thing with problems with pornography. It can certainly be a problem for a lot of people, and they shouldn't actually watch pornography, largely because of that or incongruence that they think it's wrong, it's unhealthy, their partner thinks it's cheating, they did it anyways. Yeah, it's going to be a problem in their life. Thinking about it, though, scientifically, and why the research on this for 50 years has just been a mess, is think about like, what are we actually studying within pornography? Like, what about porn could be so detrimental to our health? Because so many of the themes that are pointed to is like, oh, it's violence against women. It's a distortion of kind of regular body sizes. Things are extreme in terms of like breast sizes, penis sizes, things like that. The behaviors are like ridiculous. And so it's not typical of like what sexual behavior looks like for most people. Gendered roles are very stereotypical. But all these things exist in all other media as well, because we live in a very kind of like superficial and sexist kind of society. So that's going to exist in like Disney movies and rom-coms. So that's not unique to pornography. So is it really just the explicit depiction of like a penis going into a vagina that's like damaging our brain so much? I have a hard time like believing like that's the case. I think it is more about our attitudes going in as a consumer, as a watcher of pornography, and how we're making sense out of it more so than what's actually on the screen.
I think you did mention that you've done some work on the misogynistic views, or is there a correlation between pornography use and misogyny, or views of, gender roles or things like that? Can you touch on that a bit?
Yeah, one interesting meta-analysis, because the big thing, definitely back in the 70s and 80s with porn research, was like, does this increase violence? And that was like a big public policy push too, even when cities had more like sex districts, like Times Square was a big sex district in like the 70s and 80s. And politicians would point to like crime in that area as like being caused because like people are masturbating to pornography in porno theaters and stuff. So it was contributing to crime, delinquency, and to violence. And so from a public policy perspective, it was has a long history of being scapegoated. But a recent meta-analysis, recent as in like the last 4 years, really doesn't find that in terms of good quality studies that looked at the effects of watching pornography on subsequent violent behavior, including violence toward women. It doesn't really hold up unless the person already is predisposed to violence. They have a history of violence. They're a sex offender, high risk sex offender, high risk for recidivism. Yeah, those kinds of guys, high risk of recidivism from a previous sex offense, should not be watching violent pornography. Research has shown that, yeah, that's not the greatest for them. But overall, especially non-violent depictions within pornography, for most people, it's not going to be causing them to engage in any more types of misogynistic behaviors, including violent behaviors toward women. That's being driven by other personality characteristics that would be driving violence.
So would you say that it's sort of like the chicken and the egg? Like those people who are more driven to violence are going to watch more violent pornography?
Yeah, absolutely. And a lot of these studies within pornography are correlational. And so the catchy headline is something like porn watching causes violence toward women. It's like, no, there's a small study that was correlational that's found this like small relationship between it. It wasn't a cause effect. The study couldn't confirm that. And so, yeah, it is like a kind of a chicken or egg thing. Like there's a lot of other factors that could explain why someone could be drawn to a particular type of pornography, as well as just be attracted to a different type of pornography, as well as engage in violence. It could be some third factor that's contributing to both.
Yeah. But if you're interested in that kind of pornography, it doesn't mean that you're necessarily a violent person.
Exactly. Yeah, absolutely. Right. There's a whole host. And that's the other thing that's so messy with porn research of how even like violence is defined, how even pornography is defined. That varies across study to study. There's no universal definition of that that's used even within the sciences. But yeah, how is violence defined? How I think of violence in media is a lot different than somebody who thinks just like one kind of verbal name calling is like an indication of violence. And that's how it was coded for that study. And so, yeah, violence has a wide range of what we consider to be aggressive or violent content in the media, and it's not universally defined. And when it's not universally defined, we have a hard time like comparing studies. And so we're really just kind of doing individual studies, and we can't really do much cross comparison.
And so does watching, I guess sexually deviant is a term that they look at in the research. So does that sort of incorporates atypical sexual acts, but does it also incorporate like watching sexually deviant pornography? Like, would that be in that same realm?
It can. That's why those words are kind of useless to me. If someone says sexual deviant, I'm like, are they into feet? Because fetishism is sometimes considered like a deviance or a perversion. Like how archaic are we using this term? Or it could be like, no, this person is a rapist and they're, level 3 sex offender and they're incarcerated for that. So yeah, the terms like deviant, sexual perversion, they've kind of lost all meaning for me. And there are obviously big differences between like a foot fetishist and somebody who engages in non-sexual contact.
Yeah. Non-consensual.
Non-consensual. Yeah.
Yeah. So I think the important thing to take home is like, even if you're interested in something that is not typical, it doesn't mean that you're a bad person. You're going to become violent. You're going to become this horrible, misogynistic person. And if your partner is watching that, then also same thing applies.
Right. Absolutely. Know that just because you're turned on by something, that doesn't necessarily mean you're going to act it out. And so even if you are like fantasizing about something or watching, a fictional depiction of something in pornography that's depicting, if it was real, would be criminal, that doesn't mean that you're at risk of like acting on it. Like you have to know that for yourself. There's a difference between being aroused by something, desiring something, and having an urge to actually do that. And so for most people, things can just stay within the fantasy realm without a problem.
Yeah, absolutely. How do you think technology, like in terms of sex toys, has changed our thoughts about masturbation and pornography potentially?
Yeah, sex toys have gone through an interesting evolution through the years, from like a medical device to like a household appliance to this kind of tool for sexual liberation in the 60s and 70s, which was really cool. But more recently, sex toys have just kind of been like this commodification of pleasure, which kind of fits into our highly consumerist kind of culture right now of like, you can order, a sex toy on Amazon and get it there in just a couple of hours for like me time tonight, right? And so it's almost like a very kind of neoliberal approach to sexual liberation, that it's just focused on me now instead of like a collective action as it was more in the 60s and 70s. I'm not shitting on that 100%. I can a little bit from like a social justice kind of collective action kind of perspective of like, yeah, we kind of lost some of that revolutionary spirit from the 70s, like Betty Dodson. I mean, it has just been kind of shrunken down to like, oh, this is just for me and I need to relax and take a me day and that kind of stuff, without really thinking of like, what about collective liberation, not just feeling good for myself in the moment. But regardless, I think, the mainstreaming of sex toys, in which, interestingly, that show Sex and the City helped whenever that first aired, I think late 90s, that, yeah, there are a lot of options out there for people to stimulate their genitals through vibrators and dildos and masturbation sleeves. And especially with vibrator use, it's so important because oftentimes many women, that's their only route to orgasm. And I don't say only as like a negative. It's like you found a route to orgasm, and that's great, and that should be celebrated. And if it comes with a vibrator, it comes with a vibrator. That's how your body responds. And like what we were talking about earlier, that can only be a problem if it's perceived to be a problem when they try to have sex and aren't having the same type of response. They feel like their body's broken, their partner feels inadequate, and then they get all the insecurity around, the vibrator. And oftentimes an unfortunate recommendation is like, don't use the vibrator anymore. Focus just on your partner. You can, climax from intercourse. You'll be able to do that. Be like, well, no, I mean, that's an impossible feat for a lot of women. And so if you found a way that works for you, embrace that. Bring the vibrator into the partnered sex. That's the solution, not to take something away. You found something that works. Embrace that. Don't take it away.
Absolutely. And I don't think anyone should feel personally offended by the use of sex toys. They're just
Right.
another aid in the bedroom to help you feel better, right?
Yeah, absolutely. And that's a way to think about masturbation more in general, with or without sex toys, is that's a unique experience to have a solo sexual experience, right? Through masturbation, to have a solo orgasm. That's oftentimes meeting just a sexual desire need that, yeah, I'm horny. I got a couple of minutes. I know how to get myself off and very efficiently. And I just want to satisfy that need in that way. Partnered sex can do that too. It can meet sexual needs, but partnered sex also meets a lot of needs that masturbation doesn't, right? And so we're dealing with behaviors, while similar, they are meeting kind of different needs. And so they both have a role in our lives, and they're not competing with one another. They're both unique in their own way.
Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to rinamalikmd.com/more pleasure to download it for free today. I wanted to touch on why do people sort of put masturbation and masculinity into almost opposing categories? There's a lot of sort of people who are portrayed as very masculine, sort of talking about not masturbating.
Yeah, that was a surprise for me writing the book. My initial plan was not to gender the book at all. It's like I'm talking about behavior and I'm talking about genitals. I don't really need to talk about male masturbation and female masturbation. I was just going to talk about masturbation. Well, I learned very quickly that that was going to be an impossible feat because of how much masturbation is gendered, not only in the scientific literature, but the historical condemnation of it is very gendered. And the surprising thing was how much masturbation was being viewed historically and currently as being in conflict with idealized masculinity. And this goes back hundreds of years. I know there's a lot of wellness influencers now, like these alpha male kind of accounts that talk about this as being, not real men masturbate. You need to be out there having sex with women. That's how you know that you're a real man, and masturbation is going to keep you from that. This goes back to what I was talking about, like with Sylvester Graham and John Kellogg and all these guys from the 1800s who were saying the exact same thing. And they viewed it as how masturbation was in conflict with idealized masculinity was that as men, to be a manly, masculine man, you need to overcome your desires. You need to rein them in. You can't just give in to any desire that you have. And so by giving in, so to speak, to an urge to masturbate, that's showing weakness of character. Then there is also this belief that masturbation literally physically feminizes you. And that's where the belief that you're losing testosterone, you're losing muscle mass, all these things that you're becoming weaker physically. And in their mind, that was viewed as becoming more feminine. And so that was the other impact of masturbation, like physically feminizing you, as well as it's a weakness of character. And that still holds up today. I mean, there's a complete parallel between what was happening 200 years ago versus what some of these alpha bros are saying today.
Yeah. And none of it is true.
Right.
There is no truth to increasing testosterone by abstaining from masturbation. That is not accurate. There was one very small study with like 8 people that showed a very slight increase when abstaining from masturbation, but it was not sustained and it was not clinically relevant.
Right. And that would apply to partnered sex too. So again, kind of going back to an orgasm is not unique with masturbation. So they would also have to abstain from all sexual behavior if they want this supposed benefit from testosterone, even though there's not one.
Right. And in terms of abstaining from all sexual behavior, let's talk about No Nut November.
Yeah.
Why did people come up with No Nut November?
Yeah.
And what are potential harms?
Yeah. Well, it was created just like as a goof, right? Just kind of like an internet meme so people can rush to post at like 12:01 a.m. on November 1st that they already failed the competition, right? That they couldn't last even a minute of abstaining from masturbation. So it was largely a joke. At most, it may have been some like friendly competition that was unnecessary, kind of like that Seinfeld episode, The Contest, where they all tried to abstain the longest and they put some money on it, who could last the longest without masturbating. So maybe some friendly wagers like that, like low stakes, but not thinking this is going to be like life changing for you. So for the most part, it is just a goof, just for like memes or whatever for social media. But there are some pockets of our culture that do take it very, very seriously, and it is kind of more of a call to arms. And for them, it's just a reminder, a solemn reminder of their vows of abstinence from masturbation. And these are like the nofap guys and the semen retentionist guys who believe that by masturbating, they are doing great harm to their body, to their relationships. And for some, it's even tied into like bizarre anti-Semitic conspiracy theories, white supremacism. It gets pretty far out there. And I know there's a researcher, Dr. Nicole Prouse, is doing some content analysis of some of these message boards of these guys who are big proponents of don't masturbate, it's going to be harmful. And she's showing, all this evidence of, just how nasty these groups are, even to one another. And they're supposed to be like support groups, but they're encouraging, self-harm in terms of like suicide sometimes because they quote unquote relapsed, and like how weak you are to have to be to relapse. And so you should just end it because you're not man enough to be able to abstain. So something that can be so goofy as like No Nut November and just post a meme at 12:01 a.m. that says that you failed has a very, very dark like corner that takes that very seriously, and has some is contributing to a lot of unnecessary suffering.
Yeah. And then from a physiological standpoint, some people will try so hard to abstain that their pelvic floors will become abnormal. They will become tense and they will start having pain.
Sure.
And a whole host of symptoms. And because they're just basically white knuckling it for so long.
Yeah. And it's all self-induced. And it's like, you don't have to live this way. Right. Yeah. And I get it. I empathize. I empathize to the point until they start spouting and becoming like disciples of this message and, sharing this nonsense very angrily online. But I do empathize with the mechanisms underlying it, that they have masturbation guilt. There's something in their life that's not going according to plan. They're dissatisfied in some way. They've scapegoated masturbation as the culprit to this because that's what they're reading online, and they're trying their hardest to improve their life, and it's not going to work by abstaining masturbation. There's other ways to improve your life, but masturbation is going to not be an influence one way or the other for you.
It's sort of like a vision board, or like you say this is going to help you and then other things magically improve because
right
for the people where it works, I think that's what they're sort of using, is your brain is very powerful. If you think something is going to improve your life and you are successful at that thing, you may actually be improving your life in other ways simultaneously that are actually making a difference, but then you will attribute it to the retention or the abstaining from masturbation.
Right. Yeah, it definitely has a strong psychological effect because you are doing something that you're setting out to do. You kind of pat yourself on your back like, I'm abstaining. I wanted to abstain. Great. But unfortunately, they will masturbate at some point, right? They will quote unquote slip or relapse, and that's when all that like high self-esteem, because they're doing what they set out to do, comes crashing down, and that's when the depressive symptoms kick in, the anxiety, and even some of this suicidality that you're seeing on some of the message boards.
You've also you've done some research on sex workers.
Mm-hmm.
What are some common misconceptions about sex workers that you think we need to change?
Pretty much everything. How it's interesting because it is related to like how I approach masturbation and why masturbation is condemned, is because when we think of in society what is an acceptable or permissible form of sexual behavior, right? And we kind of create like a hierarchy of permissiveness in our culture. At the top is like married, heterosexual, engaging in penile vaginal intercourse for the purpose of procreation. Hard to find somebody in our culture to be like, no, that's kind of perverted, right?
Mhm.
That's like at the top of like socially permissible behavior. Anything short of that, which is everything else, has some type of taboo or stigma is attached to it. Masturbation is among that list, and selling sex, buying sex, but let's focus on sex workers themselves. So the selling of sexual services is way, way down on that list in terms of what would be considered permissible. So much so that it's criminalized in most areas of the United States. And so recognizing that we have this view of sex work and the selling of sex that's so pathological that it falls into a lot of these pseudoscientific traps that masturbation pseudoscience does, that it's extremely harmful to your body and society and psychologically. And it's also kind of looking at, well, is it a chicken and the egg thing? Is it a minority stress theory thing, in the sense of like, no, it's actually the stigma that's causing all these problems for sex workers and the criminalization of their work, less so than the work itself. So that was the big part of my work. I was looking at sex work stigma and how we view sex workers and the double standards that we have around them, and how that stigma can be barriers for them of getting services. So I was viewing it from accessing psychological care, legal services, and that stigma can be a significant barrier of accessing services that would actually improve their lives, dealing with the unfortunate stigma that's attached to it.
Yeah, and I think a lot of people assume that it's very damaging to their body, but a lot of times sex workers will be very diligent about actually getting tested and being sure that they are safe.
Right. Yeah. Thinking that, the stereotypes that they are vectors of disease, and that's why it's necessary to criminalize it for public health. It's like the data don't really support that. It's similar to like AIDS panic in the 80s and 90s, of thinking that they were coming from like bathhouses. And it's like, that's not really where AIDS or HIV was being spread at that time. It was just a way to kind of hone in on these stigmatized and marginalized populations, whether it's the LGBT population or the significantly overlapping sex working population, and thinking they're up to no good. They're the deviants. We need to criminalize this, heavily police them. And that's just making health outcomes actually worse.
And when you take it from places where sex work is legal, like what are you seeing in those regions compared to like the United States, for example?
Well, the better option would be the decriminalized model, and because there's still problems with the legalization model like we have in some counties in Nevada, some parts in Europe, where it's legal to sell sexual services only if you kind of check off all these boxes that the government wants you to check off on, right? And that's how you get to legally sell sexual services. And there are a lot of barriers to being able to check off all those boxes. And if you can't, you're still going to be engaging in illegal, criminalized sex work. And so oftentimes it is those who are most marginalized in society that are still hurting even under legalization models, because they don't have the proper documentation or the work permits to work in the country. And so they still have to work under criminalized conditions. And when you're working under criminalized conditions, you are working in very unsafe conditions, because in a lot of jurisdictions, they've criminalized two sex workers working together, because that's kind of like brothel keeping. So that's an additional offense. Now, with all this trafficking language, that one person could be considered a trafficker of the other, and that's like a huge federal offense. Talking about decades in prison if you're arrested and charged with a trafficking offense. So the best scenario, and exists in places like New Zealand, has a decriminalization model. It just removes the laws surrounding the buying and selling of sexual services that allow individuals who are buying and selling sexual services, that they have access to community services, social services that they would need as they would need them. So they don't have to worry about if they experience an assault while working, that they don't have to fear going to the police or reporting it or going to some other type of social services because their work was criminalized. And if I say that I was assaulted while selling sex, not only is there that stigma, and you're going to be kind of like what's known as like doubly traumatized by kind of experiencing that stigma and kind of the interrogation that goes along with that, but also you run the risk of incarceration yourself because of it. And so the best models that have the best outcomes have been the decriminalization models, but those are very far and few between. But that's always the push within the sex workers' rights movement, is decriminalization is the goal, much more so than just legalization.
What percentage of sex workers are physically assaulted?
I'm not sure an exact percentage. What's unfortunate is one study that I did, it was just an experimentally designed study. So I just looked at like the opinions of undergrads. I created these vignettes that described a sexual assault. And I varied the occupation of the woman who was assaulted. So in one vignette, it was a sex worker. In another vignette, it was a social worker. And I had a bunch of different other ones too. And then after they read the vignette, then I gave them a questionnaire that measured their victim levels of empathy toward the victim, their level of blame toward the victim, and their level of blame toward the perpetrator. And as predicted, unfortunately, what we found was that those participants who were assigned to the vignette that had the sex worker as the victim, that they viewed them with less empathy and more blame than the vignette that had the social worker, even though everything in the story, the sexual assault story, was the exact same. We just changed the profession title. That creates a different type of response for others. And if we think these are just undergrads, but the applied value of this research is think about police, prosecutors, social workers who would be nurses, doctors engaged in these kinds of cases. They're bringing these kinds of negative attitudes too. And how is that going to impact their care?
Interesting. Really interesting. You've also done some work on sexually degrading music videos.
Yeah,
and how that impacts people.
Yeah.
And I think people have a lot of concern about how it impacts the way men view women and even maybe how women view themselves. So tell us about your research.
Yeah, if I can dust off the recesses of my brain that did that. That was back in grad school. So we're talking 20-year-old research. So that was my dissertation, was because this was where this stemmed from. Was I was in grad school during the that Super Bowl halftime performance with Justin Timberlake and Janet Jackson, right? The Nipplegate, right? Right. Janet Jackson's breast was exposed, primetime television. And I remember watching that live. I remember seeing that and be like, huh, that was interesting. That may make like page 6 in the Post or something the next day. Had no idea. But collectively, Americans are going to lose their mind over it. In hindsight, I shouldn't have been that surprised. But there were Senate hearings over it. They completely changed the rules of the FCC that govern broadcast media like that to raise their fines to millions of dollars per offense. It got so ridiculous. I was like, what were they actually concerned about? They were always saying like there were children in the audience. It's like, okay, there were children in the audience. What do you think was going to happen to them from seeing that, like actually happen to them? And like, there's not an answer to that because it doesn't make any sense. Like an exposure to a 16th of a second of a breast isn't going to like do any damage to a viewer regardless of the age. So that really got me interested in looking at sexually explicit or sexually material in like broadcast mediums, television, music videos. So I focused in on music videos because I wanted a visual medium as well as an audio medium, because I was able to kind of manipulate and isolate just the visual and just the audio for different conditions. And so we did some pilot testing to find these sexually explicit music videos that were viewed as like sexually degrading. We had like them pilot testing to rate the degradation in it. So we selected ones that were selected as most degrading and used those. And then afterwards we measured some misogynistic attitudes, as well as we did have one behavioral measure of aggression to see if they behaviorally increased in aggression afterwards. And just from my little dissertation study, we didn't find any effects. And some theories would expect an effect. There's some like social learning kinds of theories and other types of media psych kind of theories that would expect some type of an effect from an exposure like that, even just a short-term exposure. We didn't find any, and there can be a lot of reasons why. One just being how much are they actually connecting with what they're watching, right? Is this their preferred kind of music? Do they see themselves in this kind of music? And kind of fast forwarding to where I am now, focusing more on pornography and less on music videos, it's very much the same. It's less about the content per se and more about the viewer and what they're bringing to the experience, and that unique interaction between their attitudes and what information is being communicated to them via the media.
Yeah. Yeah, that's helpful. I mean, I think for a lot of parents, it's helpful to know that like it's not necessarily like if they see something that you don't want them to see, which they invariably will,
They will,
right?
yeah.
Because people have cell phones, kids have cell phones, they're going to see stuff, and we didn't have. It was more difficult when we were younger to see things that our parents didn't want us to see.
Sure.
Not impossible,
Right? Yeah, we still sought it out.
definitely more difficult, but it's not that it's going to like dramatically alter your child or your or your growing brain, or if your partner sees something, or if someone you thought you really knew well, if you see them watching something that you didn't expect them to watch, it doesn't mean that they themselves are changing or are a different person.
Yeah, absolutely. At most, a lot of times it's just especially for like kids and teens, it's just confusing to them if they're seeing something that they don't really have much of a context for, much more so than any harm. And we have to think of it too, like historically, of like, what have we been like overly concerned about in our culture at any given time? And it's usually what the kids are into that the parents didn't really have growing up, right? So the focus on like heavy metal music always, and then it was rap music. And that's why at that time I was focusing on like rap and hip hop music videos, because they were getting a lot of heat for being, too sexually explicit or sexually degrading. Then it was like violent video games was like the focus for a long time. It was like leading to a whole host of problems for teens. Now it's just like social media in general. There's always something that as a society we're pointing our finger to of like, this is going to be a problem. We need to rein this in. But it's just history kind of repeating itself. It's like there's probably some effects. Again, it's more about the user individually than like the thing that they're using that's going to have like a mass effect. So a lot of the claims are kind of overblown and kind of more on the lines of like a moral panic.
Yeah, that's helpful. I think a lot of people are worried, certainly like watching TikToks and like seeing like you have no real control over what's coming next. Right. And so, is that going to change the way someone develops? And I think that's encouraging that probably not.
Right. Yeah. For the most part. Right.
Yeah.
I'm sure it has some impact like on an individual level for some, but overall it's not going to be like this society-wide detriment. Right. So we just don't have a reference for it. Right. Because as adults, we're like, they grow up with TikTok. That's got to be like rotting their brain or how like destroying their body image in some way. Our parents said the exact same thing about what we were into as a kid that they didn't have a reference for.
Right. You also done some research I had no idea about was Satanism or sexual Satanism.
Right.
So what is that, and why should we care about it?
Really. That research that I was doing was kind of a goof, intentionally. I was kind of trolling my own university because at that time, Fox News like started picking apart some of my tweets, and I had some satanic Christmas decorations up in my house that I had posted photos of, and of course they ran with that. That's like perfect right-wing news fodder of like a university professor has some satanic materials, and I didn't have these kind of satanic tattoos back then, but that was all in kind of response to like this massive outrage in right-wing media. And it's like, okay, they're doing their little theater, like that's to be expected, right? Tucker Carlson can make fun of me all he wants, but the university kind of took it seriously because there was enough of like pushback from like Fox News fans of like, fire this guy, and it's like I didn't do anything that was fireable. So the university had to make a statement like, okay, it's protected speech, number one, but we find it objectionable and it was offensive and blah, blah, blah. The president at the time was kind of going off on that. But he also said, not that I'm not only protected by freedom of speech, that I'm also protected by freedom of religion. And then I was like, freedom of religion? What is this? I was like, oh, he thinks I'm a devil worshiper because of the satanic stuff. Yeah. And it's like, I just use it because I like horror movies. I like heavy metal music. I like the aesthetic. And so I'm like, I'm going to lean into that. I mean, some articles at the time started referring to me as like the Satanist professor and like, just kind of like fear mongering stuff, like what right-wing media loves to do. And so I was like, I'm going to lean into this. I'm going to start. I was just ending my sex work research agenda at that time. That was about a 5-year project. And I was like pivoting to something new. I was like, I'm going to do a project that focuses on Satanists and to explore stigma against Satanists, how that impacts their mental health, their sexual behavior, all these different things. So I can actually become the Satanist professor that right-wing media has labeled me already. And that's what I did.
Yeah.
But the joke ultimately was on me because it was just supposed to be like a one study goof. But we got so much good data from that one study. It just took off and had some subsequent studies. Grad students picked it up as their thesis that I was overseeing. So I think where we're at right now is like 3 or 4 publications, half a dozen or more conference presentations, like 4 graduate theses. So that's been my life for like 5 years doing satanic research. I didn't know, but the issue was that we're looking at atheistic Satanists, which are the type of Satanists that are actually the religious Satanists, that they don't believe in an actual devil. They don't believe in God. They're atheists, but they view Satan as kind of like this symbolic figure of like anti-authority, high individualism, things like that. It's kind of an inverse of like Catholicism in particular. And they have their own kind of like tenets. It's really kind of focused on, pursuing pleasure and like sexuality as part of that, as long as it's consensual. And the Satanic Bible written in the 60s is very fascinating. They have a section called Satanic Sex, a chapter in it. And for being written in the 60s by a non-sex educator, just some random Satanist, the first Satanist, the Anton LaVey, written in 1969, it was pretty ahead of its time in terms of understanding consent and power dynamics within consent and like what's permissible and what's not. So that's pretty remarkable. And so I wanted to see how Satanists kind of experience that sexuality and how much of their sexual behavior is aligned with some of these very kind of free-spirited beliefs. Because what's interesting when we were talking earlier, like moral incongruence, that's largely a phenomenon of more like sex negative religious beliefs, that you have this belief that sex is wrong, it's immoral, it's a sin, but you do it anyways and you feel guilty. Well, with atheistic Satanism, they don't have that taboo, right? Mm-hmm. As long as it's consensual, it's your body, do as you please, right? Live deliciously. So theoretically, they shouldn't have that incongruence because they are living according to their values. And so what we found is that they are a highly masturbation bunch. In our sample of about 700 plus Satanists, about 90, a little over 98% masturbate, which could be comparable to other studies. They just weren't telling the researchers. So there's a sample of Croatian Catholic women, and only 30% said that they masturbate, but it could be 98%. They just didn't want to admit that on paper, right? So they're just more open and honest about it. Similarly with BDSM, 2/3 of the Satanist sample have engaged in some type of BDSM behaviors as part of their sexual play and behavior. And that's much larger than the general population. But again, it could just be representative of being open and honest to researchers, that it is actually more reflective of the general population. But too many people are living in secrecy and shame, and Satanists are like, there's no shame with this. And sure, I'm going to tell you whatever I do, if you're asking. Mm-hmm.
Yeah. Interesting.
Yeah.
That's so, I mean, it really does prove the point that it's like your nurture, it's it's how you're nurtured that really affects your thoughts and views upon sexuality.
Right. Yeah, absolutely. And then the whole Satanist thing too is just interesting to me because we were talking earlier about like moral panics and like violent video games and porn, all these things in society that get like labeled as like the boogeyman. Well, what's a bigger boogeyman in our society than the devil? And so those who embrace the devil and call themselves Satanists, I'm just interested in all kind of like the fear mongering around that group.
You are a male sex therapist, psychologist, sex educator. There's not a lot of you.
Yeah, not anymore. Like historically, it was more male dominated, but yeah, more in the minority now for sure.
So how did you decide to go into this field of education interest?
What really sparked my interest was sophomore year, University of Cincinnati, taking a psychology of sexual health class. I think it was psychology of human sexuality it was called. It was in like a 500 seat like auditorium, one of the most popular, classes on campus. And I was just fascinated. It hooked me in. Everything that I thought I knew about sex was either like completely wrong or some type of partial truth. And so I was just like, yeah, this is where I want to go. And I originally wanted to be more of an applied clinician, and I went through grad school to be that and trained to be that. But academia is a better fit for me. I enjoy more teaching. I do research better than applied clinical work, but definitely the field of sex therapy and sexual health. I've been hooked in since I was 19 years old from that class.
Cool. Do you think that there is a different perspective as a like when you so in clinical work when you see men, do you feel like you have a different perspective than maybe a female sex therapist or a female sex educator?
I don't think so. Probably. What I notice is that when I was doing clinical work, patients sometimes would have a preference, especially male patients would have a preference to see a male therapist. They felt like, for a variety of reasons, but sometimes how it would come out in therapy of like, you know what I'm saying, right? Just
Mhm.
because I'm another man in the room. But just because, experience doesn't mean you lack analysis. So like, you don't have to have like a diagnosis of schizophrenia in order to prescribe antipsychotics and empathize with somebody who has a psychotic disorder. And so you kind of, you don't have to share all the demographics as the people that you're helping, whether they're students or patients or clients. So I think there can be some unique perspectives, but for the most part, I think more of that importance is coming from the patient.
Yeah. So what are you working on now that you're really excited about?
Yeah, just getting over this whirlwind of publishing a book. We're just a few months out from publication date, when it came out a few months ago, and thinking of a second book, drafting, making some drafts, outlines right now, maybe hoping to get something together by the end of the year and start writing again, because I really enjoyed it. It was super frustrating and it's stressful. But now that I kind of know the process, at least like maybe that anxiety has gone from it, and I can just focus more on the actual writing as opposed to like, what's my editor going to do with this, and what does that mean that they're telling me? So I kind of know more the ins and outs of publishing. I can focus more on the creativity of writing. So I really like it, and I want that to kind of be part of my kind of the focal point of my career now. I'm tenured, full professor. I'm going to do less of like the research that gets published in academic journals and focus more on book writing.
That's exciting.
Yeah.
So we end our podcast with some questions we ask everyone, and they can be about anything. It
Sure.
doesn't have to be about sexual education. What's something you know now that you wish you learned earlier?
Well, just to stay on topic, that masturbation is perfectly healthy and it's not going to hurt you. I didn't learn that personally until that college level sexual health class that I took when I was 19. And you shouldn't be 19 years old and hearing that for the first time unequivocally, right? You should have been hearing that long before you got to college. And so that created, like, for most people, a lot of unnecessary anxiety for many years until you kind of have a trusted source and be like, yeah, this is perfectly normal and natural and healthy, no big deal. So just on a personal level, yeah, hearing that much earlier in my life would have been helpful.
And unfortunately, in the US, that trusted source is not going to be a teacher.
No.
So it probably has to come from a parent.
Yeah. And that's not the greatest either, because so many families are what's called like silent families. They don't talk about it.
Yeah. But hopefully, if you are a watcher or listener of this podcast, maybe you will consider talking to your kids about sex and masturbation and letting them know that what they're experiencing is normal and they should be able to come to you with questions.
Yeah. Yeah. And if they're doing it, if they're young and they're doing it in the living room, guide them to a bedroom, right?
Yeah.
Oftentimes they just get scolded right there, like, don't do that, without the context of like, don't do that in front of grandma and grandpa. Do that in the privacy of your own bedroom.
Right. Right. What's a non-negotiable, something you have to do every day?
Just eat a bowl of cereal before bed.
Yeah.
That's like a comfort food that has been with me since I was a child. But yeah, nothing.
Is it Kellogg?
Yeah, I liked it. A lot of them are Kellogg's. Yeah, I was eating more cornflakes when I was writing the book, out of spite for that. But yeah, it's just has always been a comfort food of like winding down at the end of the day, eat a bowl of cereal, go to bed. What has changed is the kind of cereal that my body tolerates. Can't really do the Fruit Loops at like midnight anymore and expect to sleep well, unfortunately, like I could when I was younger. So I have to like make it a little bit blander or more bland. But yeah, bowl of cereal every night.
Cool. What's a health hack you'd share with people?
A health hack? The biggest thing in this kind of is similar to what I could have answered that first question of learn how to say no and be comfortable with that, even if it's going to hurt someone's feelings, of just like protecting your time in that context of like, you don't have to agree to everything. You don't have to always be a people pleaser. That's not going to turn you into like, a hardened psychopath by saying no occasionally. It may feel that way. You may feel guilty and that you let people down, but just be mindful of your own time, what you need for yourself, and be comfortable with saying no. And feel the result of that. Yeah.
Absolutely. I think you can't become successful in academics without learning that.
Hmm.
I was in academics before I moved here, and I think you get asked to do a lot.
Yeah,
And if you don't say no to some things, you'll never be able to do anything.
exactly. Yeah. In early career, you're saying yes to everything because you think you have to do everything. And that's just a quick way for burnout.
Yeah. If you couldn't be a professor, a book writer, a clinical psychologist, a sex therapist, researcher, what would you be?
I would be some type of caretaker for apes.
Really?
Yeah. I love animals, particularly primates. The great apes are the best for me. So bonobos, chimps, gorillas, orangutans, something within that world. It was like a caretaker in some capacity, behaviorist. I don't know, something in that world where my coworkers are apes.
That might be the best answer.
A little departure from what I'm doing now in a lot of ways, but yeah, yeah.
So where can people find you?
Social media, I'm on Instagram and Twitter at Dr. Sprankle, and then drsprankle.com is my website. So
And make sure to buy his book, DIY Masturbation. Thank you so much.
thanks for having me.
Thank you guys so much for listening. If you have listened to the entire podcast and you're listening to my voice right now, I need a favor from you. Do me one solid favor. Go to Apple Podcasts and leave me a rating and review. This goes a long way in helping our podcast reach more listeners so they can learn the accurate evidence-based information about their bodies. And as always, remember to take care of yourself because you're worth it.